Hello, I'm Dr. Don Schiller, and I'm speaking with you at Olympia Medical Center in Los Angeles, California, about the Barnett Continent Intestinal Reservoir and my way of being a surgeon. For many years, I've been performing the Barnett Continent ileostomy, the modern day or updated version of the original Kock pouch continent ileostomy. I started doing Kock pouches with a senior colleague when I first began practice in the 1980s, but there were too many failures. In 1989, I traveled to the East Coast and learned directly from Dr. William O. Barnett his version of the Kock pouch, what we call the BCIR, or Barnett Continent Intestinal Reservoir. I've been performing the surgery ever since. Here at Olympia Medical Center, we have a dedicated nursing unit where every nurse taking care of you will know everything there is to know about the Barnett pouch surgery and procedure. In addition, every Barnett pouch patient has a private room. There's plenty of room in your hospital room for another bed if you want a significant other or spouse to stay with you. I have trained the nurses personally, much as Dr. Barnett did years ago, and I believe in a hands-on approach. For every patient, I see them every day, sometimes twice a day if needed. In addition, I like to personally change the bandage, to personally look at the incision and stoma, and to personally be sure the tubes are functioning properly and how the patient is doing. I don't like to delegate this to another provider like a physician assistant or nurse practitioner or any other level of provider. I like to be available to my patients, and certainly am during the hospital. In addition, after the hospital stay, we'll have a regular appointment schedule for the first 6 months until I'm confident, and you are confident as the patient, that everything is going well and you're going to live with this the rest of your life and do well. Of course, if you don't live in Los Angeles, these regular appointments will be telephone appointments. I have operated on people from all over the country and from many other countries as well. Even after the first 6 months of follow-up, if you have any question or concern, even a medical problem not directly related to your pouch, I'm available, the surgical team is available, our nurse coordinator at Olympia Medical Center is always available. You can always reach us through the toll-free number you see on your screen. The Barnett Continent Intestinal Reservoir is one of 3 options for people who need to have their large intestine, their colon and rectum, removed. That's usually for ulcerative colitis or familial polyposis, and some other conditions as well. The most typical traditional option is the conventional Bruch ileostomy, where the intestine is brought through the abdominal wall, protrudes above the skin about 3/4 of an inch, and you have to always wear an external bag, or what we call an external pouch or appliance, because the small intestine is a continuous flow system, and there's always waste and gas coming through. The next option is the ileoanal J pouch. With this operation, the lower rectum and anal canal are preserved, and an internal pouch of small intestine is connected down there internally after the large intestine and most of the rectum is removed. With the J pouch operation, you get to go to the bathroom the normal way. You don't need any equipment or supplies. But the range of bowel movements per day is about 4 to 7 per day, and the length of time you can wait from first getting an urge to evacuate is about 45 minutes to an hour before you may soil yourself. In addition, many people who've had a J-pouch surgery don't have an ideal outcome, unfortunately. They have frequent bowel movements, they have urgency, and they have incontinence where gas or stool will leak out when you don't intend it to. If you have a J-pouch with an unsatisfactory outcome or a conventional Bruch ileostomy, you do have yet another option, and that's the Barnett pouch. Here's a schematic of the Barnett pouch showing the self-sealing nipple valve. The stoma is flat to the skin. It does not have to protrude above the skin because you're not going to wear an appliance, only a small patch to absorb mucus. Most people with a Barnett pouch will empty their pouch, meaning go into the bathroom, painlessly insert a tube into the stoma and into the pouch. The waste drains into the toilet, and then you're done. It takes only a few minutes. Most people will empty their pouch between 2 times a day and 5 or 6 times a day. Almost everyone will sleep through the night with the Barnett pouch. You get not only a great deal of freedom but you get back control over the discharge of your intestinal waste. Once you get the first signal that your pouch is getting full and you may need to empty, if it's not convenient, you could go many hours without any stool or gas leaking out of the stoma. You will, of course, get a little full and perhaps bloated and uncomfortable if you wait too long, but nothing will come out of the pouch. The pouch does not rupture internally, so you get to control when you go to the bathroom. I've been performing this operation for many years. We're always available to you. If you have any questions after listening to this presentation, please don't hesitate to call the toll-free number on your video screen. The BCIR, the Barnett internal pouch, gives people freedom and control. Thanks for listening to the presentation.